Hello, I'm Charlie Wells, and welcome to Self Matters, the podcast where we interview the people shaping the future of mental health. This week, I'm super excited to welcome Laura Scarrone Bonhomme. Laura has the most extraordinary introduction I've got to give, so I actually have to read some notes on this because you have more bullet points in your achievements than I can hold in my head at once. You're a consultant clinical psychologist that specialises in gender, sexual and relationship diversity. You're the co-founder of Affirm, which is a training organization that's trying to train people who work in healthcare about gender, sexual relationship, but diversity. You've been an associate editor of the Counseling Psychology Review. You are a committee member of the Psychology of Sexualities at the BPS. You're a member of the British Association of Gender Identity Specialists. And then thrillingly, you're also an author, having recently written Gender Affirming Therapy, a guide to what transgender and non-binary clients can teach us. Welcome to the podcast, Laura.
Thank you, Charlie. And yeah, that was a mouthful of an introduction, so I apologize about that.
A very long introduction on a newspaper at some point in the future. Let's jump in at the beginning. We always really love to understand the person behind the thinker. Why did you become who you are today? Who is Laura? And how did you get interested in psychology?
Wow, that feels more like a therapy question rather than a... I'll try and narrow it down. I'm originally from Spain and I grew up in the Canary Islands, although my parents are both South American. And I'm an only child, and so I spent a lot of time just with my mom. And I guess that, I don't know, perhaps there was a sense of feeling slightly like an outsider, both culturally, but also not having any of my South American family around, just being my mom and my dad was sailing most of the time. And so I guess that there was always a interest in trying to understand other people, trying to understand how to belong, or, why do they do the things that they do? Why do they feel the way they do? And this interest came very early in my life. And I think it was about 10 years old when I told my neighbor that I was going to be a psychologist. I'm still surprised that I had a clear notion of what that was. But it's always fascinated me. And even when I started university, during the first year, I took last year's subjects, in psychopathology and, therapy, because I was, this is my calling, let's say. So it's always interested me and it's never disappointed me. I think that even when I face clients or people in my life, most generally, that I might find maybe less challenging or less exciting or less entertaining, like I always remember that you can learn something from everyone, even if that something is about yourself rather than the other person. How are you with different people in different environments? And so I'm happy to be in this journey, to be continuously learning and broadening the work that I do and the people that I work with.
I really like the way you kind of articulated that young understanding of a sense of other. You see that a lot in great therapists because it allows you to be an observer a little bit. It can sometimes feel a bit lonely, but it means you can observe other people and become fascinated in other people and other cultures. As you said, grew up in Europe, South American family, wanted to be a psychologist at 11, trained in Europe, but then you went back and practiced in South America. Why did you make that choice?
I finished my training right at the start of the economic crisis of 2010. And Spain already being in quite a detrimental position for anyone who was young and wanted some professional experiences. My parents were going to go for holidays to meet our family and just, spend some time with them. And I think there was both this desire that I always had to live there, growing up with your family away or from being partially from another culture. You have this idolized idea of what it would be like to be around your family all the time, what it would be like to live in Chile in this case. And obviously every time I was going, I was having a great experience because you're just there for a brief period of time, right? You're being made to feel special by the attention that you get from others and so on. So we traveled there and I sort of put myself the deadline that, we were going to go for 3 months. If by the end of the 3 months I would get a job, I would stay. And I think it was about a week before I was meant to come back that I got this job. And it was rather interesting because it was on the back of one of the most destructive earthquakes that had happened in Chile at the time. And I was given a position at the epicenter of where that earthquake was. So as I came into the placement and I was going through the city, which was all in ruins, and it was just like horrendous to look at, I just got so anxious about, where is it am I going to live? I'm coming from a very comfortable life in Europe, from all the things that I'm used to now suddenly being in a place where there's a lot of economic deprivation, where, people are different. And I just started laughing out of nervousness. And so it was a massive learning process for me to get there and to be given such an important position, helping people who have been affected by this disaster without any supervision whatsoever, with very, very limited clinical training that I received in Spain. It was a cold shower at the start of my career to get there.
I was speaking to someone a few weeks ago who was a Ukrainian psychologist, and they were obviously doing what you'd think of nice, comfortable sort of Western therapy. And then all of a sudden, everything changed, right? And now it's sort of crisis front, trauma, live conflict. And he says everything changes. The way you practice changes, the craft that you learn changes, and it makes you think differently about your science and your skill set. So what did you really learn from the earthquake experience? How did it change your perspective on being a psychologist?
I didn't get to live the biggest earthquake, right, which happened the year before I arrived. There was one strong earthquake while I was there, and I came back running. It was terrifying. But what I learned, I guess, is the amount of trauma that these populations hold. It's very common to get some shaking of the ground at different points, which might not be too prominent. And people would be ready with a bag, by their door with everything essential that they need. And you could see how easily traumatized they were after each one of these instances. And so I was like, imagine, like I had only had clinical experience observing my senior clinicians. In Spain, they don't really allow you to work with patients where you're on placement individually unless it's psychoeducation. And so this was the first time I was having my own clients or my own patients, some of which were coming saying, I don't know, I was 15 years old and I was pregnant, and the earthquake started and the water starts to withdraw. So we know that a tsunami is coming. So me and my whole family would just climb up a tree, and my family fall into the water, and I'm left up there for 4 hours seeing how the tsunami takes away my family. And I'm confronted with narratives like this, thinking, what on earth can I do to help you? Like, is this helpful that I'm listening to you? What else do I need to do? So I felt really out of my depth, in the sense that I really wanted to help, but I didn't have any real mentoring by my side. There was no mandatory clinical supervision there. There was no provision from my manager at the time. And so it really drove me to try and understand and ask very directly, is this helping? What else can I do that it might help? What are you struggling with? And to really be self-sufficient and driven to find answers for my patients.
Too often we think about, like, okay, what can I do from my knowledge base to this person, right? Rather than what are we discovering together in partnership that can help you better? I think, and I suspect that more partnership philosophy has led to your kind of future expertise. So how do you go from being in Chile, helping people in an earthquake on kind of collective trauma, to becoming infamous and an author in gender, sexual and relationship diversity? That feels like they're a long way apart.
I felt like the challenge that I wanted with living in Chile and working in that environment, I had met the goal. I was like, okay, I'm ready for a change and for something new. And at the time, there were the Olympics in the UK. And I was like, you know what? I think I'm going to go there. I'm just going to try my luck. So I arrived at the UK and started working as a au pair, living in with a family, looking after 3 young boys. While I managed to validate my career and to get my HCPC registration. And I started working in psychiatric hospitals and in CAMS services, a variety of CAMS services, sort of like following on what I was already doing in Chile. And this job came out in NHS Jobs at the GIC in London. And I had never met a trans person before. I had watched a lot of documentaries out of interest and movies and things like that. And I do have quite a lot of gay friends and bisexual and, queer friends in general. But it was completely new to me. So I really don't know why they gave me the job, but that's how it all started. It was out of luck.
I think it's fascinating how people can just meet someone or apply for a job and it can kind of shape a whole new area of interest. And so all of a sudden you found yourself working in this clinic and started understanding how the system works a little bit differently. We're moving into kind of some of the systems thinking. You were kind of talking to individuals, but you're also starting to understand that actually maybe this is less about how an individual is perceived, but more about like how they interact with the system around them. Can you give us a brief introduction to how you see gender, sexual and relationship diversity being approached, I guess, wrong by the therapeutic community? How can we think differently about that?
I'm currently reading a book that I've been recommending to everyone I meet. I'm that kind of person. I'm like, you have to read this. It's called Am I Normal by Sarah Cheney, and is an excellent summary of the notions of normalcy in our society, and actually how biased they are, right? How the notion of normal is not something innate to us, is a concept that was introduced 200 years ago. It's a mathematical concept that later on was moved to social psychology to try and understand height and weight, and later is introduced in intelligence, when migration happens around the First World War. And so it's continued to evolve, getting ingrained in every area of our lives to sort of ask us, I don't know, is my body normal? Is my relationship normal? But this notion of normal is absurd, because what we have come to define as normal is what the scientific community is, which is the average, highly educated, white, cisgender, heterosexual person, most generally man, right? And so when we find expressions of identity, desire, body shape, beauty that go beyond these notions, we get confused. We don't know what to do with it. And that anxiety that it creates in us, rather than try and understand it without problematizing it, we go and say, oh, there's something wrong with it. We need to make you fit this mold. We need to make you, normal. And I think that that's the greatest issue that I find working with gender and sexual diversity, particularly, but also with any form of neurodiversity. And we get confused. What do I do with a patient who is autistic and who is showing these traits? Well, first of all, establish with them, is this an issue to you? Is it affecting you in any way? Why am I trying to change it? Not too long ago, I was working with this young person, 16 years old, and they're gender fluid, and they're also autistic. I was asking about their emotions, and they're like, it's always in a 5. It never really moves. And I'm like, is this person not having more extreme emotions? Is this bad? What is going on? And for sometimes a couple of sessions, I thought I need to work in helping them have more full experience of the world. This is my own understanding of the world. Then I spoke to the parents, and it's like, oh no, they've always been like that. Even as a child, they never had a tantrum really. They've always been quite in the middle. And then it's like, okay, this is who this person is. What am I doing challenging this? It's just, my own sense of acceptance. So I'm working really hard all the time, trying to understand whether this is a problem at all for the individual or for the relationships or for the society, and to try and help them guide their life in a way that will make them happy, not that would make society happy or the families happy.
I think it's such a wonderful way of putting it. One of the things I find so interesting, not being a psychologist, not being a therapist, but working in the therapy space, is how much therapists want to find a kind of a label and a paper and a condition type, or just something that they can do to build their therapy plan on. Whereas actually sometimes listening to someone, understanding, what are the barriers that are kind of preventing you feeling and being the way you want to be, is it can get you to some quite different answers. You didn't just decide to stop and say, I'm just going to treat lots of people who are psychologically struggling, who are in this sort of minority. You also decided that you wanted to try and more broadly teach the health systems about how to better understand these need states with your training courses and firm. What made you decide that you wanted to start trying to change the system at a larger scale rather than one person at a time?
I think that the process of coming into this field has changed my own worldview. It has been tremendously profound to understand all of these things that I didn't. These sort of questions that you grow up thinking, when my mom would tell me, you cannot do this because this is the things that boys do, or you need to be more ladylike. So in what ways have these structures of gender shape my relationship with my own bodily movements, with the way that I express myself, with the way I communicate? how do I police other people? My dad the other day, he got kind of like startled by something, and he did a squeal, and I made fun of him. And he's like, "Are you really, making fun of me showing some femininity or showing some," and it's like, oh my goodness, I'm doing it myself. I'm meant to be, at the core of the people that is most understanding, yet I'm also programmed to do these things. So it sort of helped me understand how, even as a cisgender and a heterosexual woman, all of these things are part of my own life, of the way that I understand my own sexuality and what am I and not allowed to feel, or what is pleasure. We've sort of, for the longest time, tried and classified sexuality as a straight or gay, and only in the last maybe 30 years you can say bisexual. And it's like, why your sense of pleasure when in food is so wide, right? And I like chocolate and I like berries and I like everything that there is. Why, when it comes to sex, we only can classify ourselves as to who do we like and what is the gender identity that they're performing? What about, I really love being caressed on the neck, or I love a foot massage is very arousing. So we are limiting our own understanding of our pleasure, of our gender expression, and on the ways in which we relate to one another. And to me, this felt such an important message of liberation to communicate not only to trans people so that they understand that being trans is perfectly normal. The only thing it's rare. It is rare being trans, but it's normal. And I think that this is it. I work day in and day out with people who feel oppressed, who feel defective, disgusting, who fear that people are going to look at them and they're going to shout, they're going to abuse them, they're going to try and kill them. And very sadly, this is true. It is perhaps an overrepresentation, and it's a minority of people that end up going through these experiences. But I think it's between 20 and 30% of trans people have received some form of transphobic abuse. So we are making some great movements within the Black Lives Matter, right? We're trying to challenge racism. We've become a lot more aware of the things that we can say and we cannot say and why. And I really hope to be able to contribute so that the same situation would happen for trans lives, for the human rights of these individuals, because it's just so unfair, and it affects psychologically so many people. And it puts us clinicians in a terrible position. It's really challenging, even working with organizations like the British Psychological Society. There is great conflict. There's differences in political views, And to me, it's very hard to understand because I just listen to my patients and I'm like, can you not see how hard this is for this group of people? But I guess that a lot of people have an opinion on trans people and they're very certain about what they think. Yet very often, this very same group of people have never met a trans person, or they have met one, or they read one story about a trans person who also happened to have done something bad, and that way all trans people are the same.
It is extraordinary, the breadth of opinion compared to as you said, the size of the population. It's extremely normal, but extremely rare. I love the idea that you said that actually, why do we have to have these kind of opposing labels, right? Male, female, gay, straight, and actually there's all of these different flavors in between. Like we like different foods at different times in different ways. One of the things that I often find interesting in this debate is lots of my friends, the labels are important to them, right? Finding their label meant they found a community and they found something that felt like it was them. But actually labels can also be separating. They can be us and them. So like, how important do you think language and labeling is? Or should we just in a position where we're accepting any recipe of self?
I like that. I think absolutely we should be accepting any recipe of self. I oftentimes use the intersectional frame to try and understand a person, right? So we sort of think about the structures of power and oppression that exist in a given society and how being in different ways, so your age or disability or ability, your race, your ethnicity, your religion, how do they place you? So in a way, I try to encourage my patients to see themselves as different pieces of a puzzle, right? And I think that a good way of seeing it is that, you can be Black, you can be old, you can be well-educated, you can have children, you can have all of these things. And also you can happen to be trans, And that's, I think, it. When we start to show impressions of xenophobia of any kind, transphobia, racism, etc., we start seeing just that label of the person, and we're missing the whole world that is behind, right? So I think that you're absolutely right. For a large group of people, and particularly marginalized groups, having a label, not only to define them, but to define their experience, is tremendously important, because once you have the language, then you can properly understand yourself. You don't feel so alone, And this is the repeated experience of, I don't know, I thought that everyone hated their body. Suddenly I read about gender dysphoria, and it's like, oh, wow, it really makes sense to me, right? And so there's so much information available now that it can open a world. But also I find people who are sick of being labeled that way, and they say, I just want to get on with my life. I don't want to be a trans person to anyone. I just rather that my identity remains stealth and that nobody knew. And this comes because there's so many other important elements of myself that being trans is such a small part. I don't give it importance, but also because it's so stigmatized that I worry that the relationships I've built on the assumption that I am cis will be broken if anyone knew that I used to present differently when I was younger.
We couldn't have this conversation without touching on some of the kind of questions that come up in wider society. So I'm not going to get into the politics, but I do want to get into the medicine. One thing that I find kind of interesting in all therapy space is how you have some therapists that are very understanding of self and individual, and they don't really see themselves as a medicalized intervention. And at the other end of the spectrum, you have people who think of themselves as sort of a scientific part of the medical community. I'm always interested that gender fluidity, the trans process, is sometimes sort of medicalized at different ages, and because obviously there's hospital interventions that some people want to do as part of that experience. How do you think gender and medicine should be treated?
I guess that to some degree it is inevitable that within trans identities and within medical transitions, there would be an element of trying to classify or categorize people. In the UK, we see it because there's a need to obtain a formal diagnosis of gender incongruence or gender dysphoria before a person can be granted access to hormones or surgery. However, just the diagnosis alone doesn't provide you that access. So, for example, I may see a person who, has been struggling with gender incongruence for most of their life, is very clear, they have a discomfort towards certain characteristics that might be typically masculine or feminine. And so to me, they are clearly trans. However, they may have not taken sufficient steps to live authentically or to sort of like enact whatever they've been feeling during all this time in their life to be sure that they should access hormones or surgery. Internationally, there's a great variety of things. So in the UK, we need to have that diagnosis, and we have these power dynamics, where actually the clinician has all the power to tell the person, yes, you can or you cannot. Whereas in the US, for example, we have a informed consent model. So you only need to go to the doctor and you say you understand what is it that it is required or what is it that this intervention would do, and then you are given access to it. So it is political even within clinical environments. I believe that, with time, everything will shift towards an informed consent model, particularly when we're talking about adults. With children, like you say, it's very challenging because, yes, we are developing ourselves in a variety of ways. We are getting to know ourselves. There's a great desire from both professionals and parents to protect these children, yeah? But at times we need to question, what is it that we're protecting them from, right? Are we protecting them from our own fears of stigma? Are we protecting them from themselves? Are we protecting them? What is it that we're protecting them from? Because it's never a straightforward decision, but many of the young people that I work with, who might be now 16, they have consistently described incongruence since they were 10, let's say. So it's years of their life where this has been day in and day out part of their experience, when they may have tried to go through therapy so that they can better understand themselves, so that they can try and degender certain experiences. So, for example, people assigned female at birth who might identify as non-binary or as trans male may feel very dysphoric about their periods, right? It's sort of like, I hate it, comes that time of the month and I feel really feminine, I feel horrendous, I almost feel like other people can see it in me, I may stay indoors because it's too much for me to bear. So you can try and work with an individual to provide them with some skills and resilience, and also to degender it, right? This is a biological process. Perhaps this is nothing to do with being female or male. Can you try and deconstruct it in that way? And depending on the person, these interventions might help, let's say, 10%, 20%, and 80%. But for most trans people, there is a baseline level of dysphoria that at times cannot be shifted just by psychological work. And they can only be shifted by accessing those hormones or surgery. And it's so interesting because in my case, I only provide hormones or surgery to people over the age of 18. And this is because I never got to train at one of the child and adolescent mental health services. So I feel most confident in that realm, although I provide therapy to under 18s. I've supported over 500 people through accessing these interventions. And they come, after 5 months, 6 months, a year, and the massive change, not only physical, but psychological that they experience, where they feel great. When one of the main concerns when I speak with parents is the fear of the transition. Is my child going to regret it at some point? And here is where the impact of the media has been very detrimental to the health of young trans people, because the rates of detransition, every 1,000 people, 3 would come through saying that they regret it, or they might not even regret it. They just said, look, I wanted to do this for so long. I did it. It wasn't what I expected, but I knew I had to go through it, right? When we think about those risks, you have greater chances of getting pregnant using contraception. There was a recent study talking about regrets among people who had become parents, and it's about 30%. We're talking about 0.03% here. So in terms of any intervention as well, any risks of having any health outcomes that are adverse, they're always greater. So it is not without risk, but also the risks are rather reasonable.
Painting a statistic like that, it's very stark, isn't it? You're absolutely right. That is a tiny proportion of people that are going to regret that decision. And actually, it's very few people who are going through that full transition. I guess when you look at your 3 pillars of gender, sexual and relationship diversity, the nice thing you have in sexual diversity and relationship diversity is it's almost society expects you to have you can experiment a little bit, right? You can find out who you are and you can play it. It's not fixed A or B at birth, but gender, society thinks about that as a much more of a binary choice, right? So there's less societal space for exploring your gender, whereas actually it's becoming more normalized to be able to explore your sexuality or your relationships. What are the tips that you could give the system, the psychological front door, I guess you could call, in the British society, in order to make it easier for this first step for people to go and start talking about this? What are your top 5 tips?
Actually, I just came back from a conference in trans health in Cork at the University College Cork. And we were making a point among the attendees, which I thought was really interesting, around training. So the thought was like, how useful is it really to have training that focuses on language? And someone in the audience made a really interesting point that actually, even though it's useful and it should be a part of it, to some degree, it could also be harmful, because suddenly clinicians are armed with the appropriate language to talk about things that they might not fully understand, or they might not have yet challenged their own unconscious biases when it comes to working with trans people, with non-binary people, with queer people of any sense. So I'm using the right language, then the patient opens up because this person understands, they know what they're saying. And then with my own negative views, I can make a lot of harm. The problem is that there is so much reparative therapy of some form of another, or reparative praying, or so many of my patients have had experience of this sort that are so damaging, right? This is your family, your community, the clinicians that you trust in telling you are sick in the head. There's something so wrong with you. We need to make sure that goes away, right? And like I said earlier, we all grew up with this ideas of what is the ideal woman, the ideal man. And within this hierarchical structure, trans people fall at the bottom, undoubtedly. And there are ideas of all sorts going around, right? That trans women are sexual predators. And these are narratives that we had already with gay and lesbian communities, right? There were points in time where gay teachers weren't allowed around children because they were thought to be more prone to sexually abuse them. How horrendous, how outrageous. Yet these narratives are going around trans women, and they're not allowed access to toilets. The other day, one of my patients said, look, trans people, we're constantly dehydrated. We're constantly thirsty because we cannot drink when we're going out in fear that we might need to use a toilet and we might get thrown out or we might make someone else feel uncomfortable. I think that we need to be a bit more conscious of the reality of the day-to-day of the lives of trans people, and a lot will change. Part of the training that we do at a firm, it really focuses on understanding what are the stereotypes, and how were they communicated. Did you have an uncle that was tremendously racist? And we all smile along when he said a racist joke because we felt awkward about challenging it? Or did we used to watch all these TV shows in the 80s and 90s that ridicule trans people? Or how have you absorbed this? To what degree are you consciously or unconsciously enacting these negative attitudes? And to what degree do you believe that your patients are sick in the head and they need help for it? So those are the questions we really need to start asking through reflective practice, through compassion to the self, because we're also victims of this system, but mostly compassion to our patients. And then after that, we might be able to be better clinicians, even though we might not know what to say exactly, almost like I told you at the start of my career in Chile, not really sure what to do, but I'm willing to learn and I'm willing to listen to whatever might be useful to you.
It sounds great. I should make sure I go on one of these courses too. I think there's something very pure in the idea that, as a therapist, we're there to try and help someone overcome some kind of emotional thing that's being affected around their world, right? There's something that doesn't feel right about the way they're experiencing something. That doesn't mean we're there to change them, right? We're there to try and change part of their understanding of what's going on. So people aren't going to therapy because they're trans, as you're saying. They're going to therapy because there is something about their life that is causing them stress. I think your toilet example is a great example. I could see why someone might want to talk through that experience. Talk to me a little bit about your book. It wasn't just a guide for therapists. It was about a guide to what transgender and non-binary clients can teach us. I think that's a really lovely way of looking at it and quite different. What are the key themes of the book?
So, like I said, I had never met a trans person before I started working at the clinic. And so it is truly what all my patients have taught me during that time, or the highlighting points. So we start by talking, a little bit about what are these notions of sex and gender. We make sure that we understand them correctly in the book, and that we define them. And all of it is sort of mixed with personal narratives and experience. So I'll tell you what, I read a lot of very clinical gender books. You have this patient, you do this thing, and that's it. But I love Irving Yalom, and I thought I want to be the Irving Yalom of gender, which obviously I am not. I'm not that delusional, but I wanted to give that flair. I wanted to be a real person, and I think it's patients show so much vulnerability in the process that I think it's important that we also are vulnerable and aware of our own experiences. So I put parts of my own experience and different thoughts around. Traveling in Russia and seeing so much rigid gender norms on one side or the other. I talk about different patients in the therapy room and what it was like to sit with them. I talk about documentaries I've watched and, interesting points that I've taken out of it. So sort of takes you on a journey from understanding what is the experience of parents and how can we support them. So there, for example, I use the stages of grief model, which many parents have found very, very useful. We interview parents on their own experience and what they struggle with, what have been the joys of, learning about the gender identity of the children. We interview people who have detransition, and so it's not only my voice and the voice of my co-authors, but we also bring, authentic voices of communities to be able to share in these little interviews whatever it was like for them. And we got as well the wonderful Alex Yantafi, who is a very well-known non-binary clinician and family therapist and author, writing the intro for us. And we also got a trans artist creating the beautiful cover for us. So it was really, really fulfilling, the whole experience, and very collaborative with the communities, because we were trying to basically avoid, again, when we were talking about medicalizing, othering, we are part of, and we all have the same goal.
Yeah, I think it's great. We definitely need slightly more emotional access to this kind of topic rather than it being either like a clinical, rational book. You're a person who's done all these extraordinary things. You're pioneering thinking within a certain space. You're thinking about systems thinking. You're thinking about training. What do you do to look after yourself?
So I've got a 2-year-old, which means that this leaves little time to look after oneself. There's no time. Now, actually, this year I've started to actually look after my physical health. So I've started to go to the gym, and I'm loving going to the different classes with all this group of women. Mostly, it's very good fun. I'm very creative, so I love drawing and punch needle and anything that I can do with my hands. And my husband and I have recently purchased a piece of land in the north of Tenerife. So we go there and we started to just plant things, and it's amazing the connection to nature, how it changes and how it makes you feel different. So I think from now on, gardening might be the main thing we can do, considering that the 2-year-old can be running around.
I'm a massive gardener. I love gardening, and my dream is to own pieces of land and cover them in trees. So I quite frequently am driving around the country looking at little tiny plots of acreage that I can kind of plant trees in. So I'm very jealous you've done that in Tenerife. With your kind of knowledge and background of speciality and then becoming a parent, were you surprised by how sort of gendered the world of parenting is?
It's been very interesting because, I've wanted to buy clothes for him, and it's all either blue or pink. It's all very gendered. When I've bought anything that is pink, it's very interesting that everyone just goes straight away for saying she and this little girl. And there are times where I correct them, and my husband is like, "Why are you even correcting them? What does it, who cares about this?" And I'm like, "You're so right, but there's something that doesn't sit right? You're not saying this person correctly." And it's like, no, again, I'm sort of conscious of my own reactions and my own policing of the gender of my child. And before he was born, I was like, yeah, let's have a very gender-free upbringing and give him lots of things to play, as well, dolls and makeup, but anything that he might be enjoying. And I hope to some degree he might be very, free with his gender expression. He is so typically masculine, so I'm slightly disappointed for now. I continue encouraging femininity for him.
Let's do the big question. You're suddenly the president of the world. We've been talking a lot about the UK today. We think that there's lots of work to be done on these issues in the UK. If you look globally, there's a lot of work to be done. What would be the one big change you could make in the world to improve the mental health of everyone?
I would eradicate the notion of normal.
That could be the title of your next book. That's a fantastic title. Eradicate the notion of normal.
I think that if we were to see ourselves in more than just binary terms, more than good or bad, normal, not normal. If we were just to think, I'm a little quirky in this way, I'm slightly different to other people in this way, or I'm coping well, even though this might be unusual, or I'm not coping that well, it would really change things. I think that as clinicians, we would have to work a little harder to not use the tools that we used to classify people. And I think that the patients would also have to work harder to understand themselves and their complexities without judging them. And I think that's it. It's about knowing your own identity, knowing how you cope, knowing the things that have affected you, and understanding that all of it is a matter of chance, right? You landed in the family that you landed, you have the experiences that you've had, And so learn to accept and to cope with them and to try and better yourself, right? Aside from, have you got a problem and is there something wrong with you? So I think that would bring a whole lot of compassion and would reduce a lot of the stigma that a lot of communities have.
I very much like the idea of let's get rid of the idea of normal and let's explore what ourselves can be. Great, Laura, it's been absolutely fascinating. Thank you so much for your time.
Thank you so much for having me.
Thanks for listening to Self Matters. We've got new episodes out every 2 weeks, so make sure you hit follow and subscribe so you never miss an episode. You can listen to us on Spotify and Apple Podcasts, and of course watch us on YouTube. As always, head over to our social media channels to find out who'll be joining us in the next episode. That's all for today, though. See you next time.